My world changed the day that my mom told me that my grandma had breast cancer. My grandma had breast cancer and both breasts had them both removed. My other grandma has had it in one breast and also had it removed. They are both now cancer-free. I've had a couple great aunts that have also had it, and I've had one great aunt that died from it. Hopefully it will be the last one. Breast cancer is very common to happen to women, so my mom has to get checked, and when I get older, I have to, and along with my younger sister. Breast cancer, according to Medical News Today, also known as MNT, says this is the kind of cancer that develops in breast cells. There are very many symptoms and ways to diagnose this. Some of the most common symptoms include lumps in the breast, in the underarm, swelling of the armpits, pain or tenderness or any change in size, texture, color of the breast or around the area. There are also ways to diagnose cancer. According to the Mayo Clinic staff, the tests they use to diagnose are mammograms, breast ultrasounds, biopsies, and MRIs. There are many different stages. There's the early stage, stage 1, stage 2, stage 3, A, B, and C, and stage 4. In the early stage, there is no symptoms at all, and it's very hard to tell if you have them. Stage 1, the tumor is 2 centimeters or smaller and is not in the lymph nodes. Stage 2, it's larger than 2 centimeters but not larger than 5 and is not in the lymph nodes. Stage 3, tumor is there, usually larger than 5 centimeters. 3B and 3C, tumor is in any size and has spread throughout the breast. In stage 4, it has spread throughout the body, usually in the bones, lungs, liver, and brain. The treatments used can be several drugs or surgery, which includes lumpectomy, which is removing the breast, usually used for smaller tumors, mastectomy, removing the entire breast, sentinel node biopsy, removing limited number of lymph nodes that the cancer is found in, axillary lymph node dissection, removing several lymph nodes in the armpits, or removing both breasts completely. After surgery, there are ways to cope and your support. You learn more about the cancer after you get diagnosed. That way the surgery helps. You keep your family close. Talk to survivors that have survived breast cancer. Talk to someone about your feelings that truly cares. Factors that causes breast cancer is getting older, genetics, obesity if you have had cancer before, alcohol consumption, radiation exposure, and height, and of course if you're a woman. If you're 50 years or older, it's likely for you to get it if it's in your family history or in your relatives. Or if you're taller than average, you're more likely to get it too. Ways to lower this is breastfeeding, consumption, less alcohol, stay fit, maintain normal weight, feast on fiber and fruits and vegetables, eat fish, switch to olive oil, and limit hormone replacement therapy. In conclusion, breast cancer is very common in older women that is in their history or in their family tree. There are many symptoms to detect if you've had breast cancer, so you can try to catch it at an early stage before it progresses throughout your body. There are 7 well-known stages of breast cancer, so if you get diagnosed by the doctor with a test to research your stage so you know what's happening, you are not alone. Keep your family close, talk to survivors, and listen to them. I hope you have learned more about breast cancer and keeps you aware.